everyone, it's Dr. Cleopatra Pusey again with Life is Beautiful MD and Life is Beautiful Ministries. Remember, we're learning from the basic instruction before leaving Earth, the Bible, and I want you to know that your body is the temple of God, so we have to treat it as such. Okay, if we know that someone important is coming into our home or into the state, or we're going to a concert and we're going to see someone very prominent, we do our best, we dress our best, we put on our best hair, our best makeup, our best dress, our best everything to meet that president or that dignitary or whoever that is. But just remember, you matter, you matter, you matter. And because you matter, I want to encourage each and every one of you to make sure that we're not just dressing up the outside, but we're dressing up the inside. I want you to go and see your primary care physician at least once or twice a year. You should go and get your full labs drawn, your liver function, your kidney function, your thyroid function, your cholesterol function, your white blood cell, your red blood cells, everything that you need to make sure inside is running properly. At least once a year, go to your doctor, get everything done. If you're a certain age, need to get your EKG. If you're, above 40 for women, we start doing our mammograms. Make sure we don't have any cancer. For women, at age 21, we start doing our pap smears, okay? And go to your OBGYN. They'll tell you what to do and how to go along with that. Either you follow up in 6 months or 1 year or 2 years or 3 years. They'll tell you what to do. Make sure you go, if your primary care does, OBGYN and pap smear stuff, make sure you get that done, ladies. When you get to 40, 40 to 50, you start getting your mammogram done, and you follow, at least once a year to get it done, because mammogram can detect breast cancer up to 2 years in advance. It is very, very important. Okay, when we get to 50, we do our colonoscopy, and make sure, there's certain cancers that we can check for women. We could check for breast cancer, we could check for cervical cancer, and we could check for colon cancer. But we need to make sure we go to our primary care physician. If the primary care physician looks at your white blood cell count, they could let you know if you have an infection or not. If they look at your hemoglobin and your hematocrit, they could tell you if your iron is high or low. They look at your white blood cell counts and, God forbid, can tell you if you have a cancer or anything else going on in your body. They look at your liver function. They could tell you if your liver is healthy. They could know, if your liver functions are elevated. They could look at your kidney function, same thing. Tell you what to do and where to go from there. They could look at your cholesterol levels and let you know if you're in danger, whether or not you need to take cholesterol medication or, supplements like red yeast rice with CoQ10. You should always implement diet and exercise into everything that we do every day, okay? They could check your vitamin D level. Vitamin D level, a lot of us are very low. And especially, we need to check that, because vitamin D deficiency can put you at risk for, heart disease, cancer, Alzheimer's, dementia. If you have enough vitamin D between 40 and 60, it could help you to prevent you from getting certain kinds of cancers, okay? It could help you to prevent you from, it could boost your immune system so put you, at a better place not to catch COVID. There's so many things to do. There's certain multivitamins and minerals that we need to take, and there's lots of different ways to do it. We have scanners that we could check your nutritional level and stuff like that. All of this stuff needs to be done. If you get to age 50, or if you have diabetes or high blood pressure, high cholesterol, we could do an EKG for you. When you come to the doctor, we do your blood pressure, and we could tell you what normal is, what isn't, and give you a log for you to keep to make sure that you don't develop silent blood pressure, because a lot of people have blood pressure and they don't know until they have chest pain, or God forbid they get a massive stroke. It is very important that we watch what we eat. Moderation is the key. Low fat, low carb, low sugar, okay? And all of that stuff we need to do. Try to exercise. I tell my patients not to, I try not to use the word exercise. I try to tell them to find a song that they like, and they could put it on, electric slide or cha-cha slide or whatever it is, for 5 minutes. Just keep dancing for 5 minutes and repeat that song, or find another song and dance to it. Just do some dance move. I promise you, it'll help you. 10 minutes a day, 15 minutes a day, or walk around the block, go to the mall and walk, go to the track and walk, go outside, do some gardening, pull the hose from the front to the back, water your plants, do something active, vacuum your floor. There's a lot of different things that we can do, and that we could get active and exercise. If you have a stationary bike at home, get on the bike and watch a podcast, listen to a podcast, or watch something, do something like that. That's for ladies. For men, same thing: liver function, kidney function, thyroid function, cholesterol function. We could check all of that for you. A lot of men are afraid to go to the doctor because they're afraid of that prostate exam. Don't be afraid to get the prostate exam done. We could draw it in the blood. We could draw the PSA, prostate specific antigen. We could draw it in the blood for you and check that. And God forbid, if that's not between the right levels, then we send you to a urologist, and a urologist can help you to check to see what's going on, whether or not you have an infection, or whether or not, God forbid, is prostate cancer. There's a lot of preventable things that we can do, but we have to take the step by going to our primary care physicians. Remember, let's not just dress up outside. Let's try to dress up inside, make sure inside is good. Go ahead, if you're 50 or so, go and get your EKG done. Let the primary care physician look at it and let you know, if God forbid, if you need to go to a cardiologist. That with, some other lab tests like your cholesterol tests, your blood pressure, all those things, your primary care physician will put together and tell you where you need to go. Okay? Even, God forbid, you have COVID. If you have COVID, don't just stay at home and try home remedies. There's medication for treatment. You could go to your doctor. You get Zithromax 500 daily for 5 days, along with Decadron, 6 milligrams daily for 10 days. There's thiamine, that's a vitamin. There's zinc, there's multivitamins, there's elderberry, which has vitamin C and zinc in it. There's so many things that you can do to help yourself to be better. Don't just stay and not know what it's going to do for you. And God forbid, if you don't feel well, you go to the hospital. The hospital has monoclonal antibodies that for people that are not extremely sick, they could get that. And others can get, if you're that sick, your oxygen is low, you're short of breath, you get admitted to the hospital. We have remdesivir that we're giving. We have convalescent plasma. We give you antibiotics and steroids, IV steroids. In addition to that, there's a lot of help out there. So please, I'm asking you, let's just take care of our insides and not just beautify the outside, but make sure we get the inside good and right. There's so much more that you need to know. You need to learn, what are the, what's high blood pressure? What are the levels? How do you diagnose diabetes? How do you diagnose high cholesterol? How do you diagnose hyperthyroidism or hypothyroidism? We're going to do those little by little and get there. But here's to your health. Start by making an appointment to go to your primary care physician and use that as your baseline and move forward. Be blessed. Remember, your body is the temple of the living God. We have to take care of it. And if the dignitary is coming, we're going to dress up and look nice to meet the dignitary. But remember, you are very important, and your body is a temple of God, and God is with us every day. So we need to look good inside and outside for Him and for ourselves and for our entire family. So blessed to be a blessing. This is Dr. Cleopatra Gordon Pusey with Life is Beautiful MD and Life is Beautiful Ministries. Be blessed. Take care. I love you with the love of the Lord. Talk to you soon. Take care. Bye-bye now.